We usually think of our overall health, but what about our brain health? What factors encourage healthy and happy brains? Sarah Lenz Locke is the executive director of the Global Council for Brain Health, or AARP, and she's with us this morning. Good morning, Sarah.
Good morning, Angie. It's great to be here.
I'm so interested in the AARP study that reveals some very hopeful and exciting news about age-related cognitive decline.
Yeah, it's terrific. AARP convenes the Global Council on Brain Health to bring together the world's greatest scientists to look at what the science says about what works and what doesn't to maintain your brain health as you age.
And were you surprised at some of the findings?
Well, you know, it's really interesting. The council's been meeting for 6 years, but this is the first time we looked at the differences between how hard or difficult it is for some groups of people to implement the 6 pillars of brain health. And what was surprising is that the recommendations that they came up with are really not that difficult. It's about community will to institute them.
Well, let's walk through then the 6 pillars as you've listed here and kind of explain how that all works and how we can work it into our lives.
Well, the number one thing that we always talk about is exercise, and it doesn't have to be that much, just 15 minutes a day. What the council recommends is 115 minutes over the course of a week. And that can make a tremendous difference in your brain health over time. The next one that I talk about is sleep. That's an instant one. Everybody knows they feel better after a good night's sleep, but people don't work at getting better sleep. So I set an alarm to go to sleep rather than to wake up.
Yeah, great idea.
So the next thing that everybody loves to talk about is diet. And there are foods that you can eat, like leafy green vegetables, low fats, and low salt is important. And here, the good news is it doesn't have to be you never eat some of the good stuff. It's about foods that you eat more of, like high fiber, lots of things you've already heard about. Managing stress is another pillar of brain health, but a lot of the other ones help you manage stress effectively. And social engagement, it's incredible. We found that social isolation actually can increase your risk of dementia by up to 50%. So getting out there, staying connected with friends and family are super important. And I think I'm missing one out of
You have social engagement, sleep quality, intellectual stimulation, activity, and nutrition. I think you hit it all.
Well, you know, thanks for saying cognitively stimulating activities, because people think games is what is going to be key, because AARP does surveys all the time. And you can get good at games, but it doesn't mean it's going to translate into actual better brain functioning or cognitive functioning. So keeping your mind stimulated by taking a class, talking with friends, challenging and learning new things is key.
Can you send our viewers to a website for more information or recommend readings?
I would love to. If you go to aarp.org/brain health, you'll be connected to a world of resources that can give you all kinds of information, whether it's our online program, Staying Sharp, or it's the reports of the Global Council.
Sarah Lenz Locke, thank you so much for this very exciting and hopeful information.
Have a great day.
And you as well. We'll be back for just a minute with more lifestyles, so stay with us.